So that's us recording there. So I'll introduce myself. I'm Niamh Carey and I'm from the Irish Heart Foundation and I'm working with young stroke survivors. And that's anybody under the age of 65. All our services are accessible to any age group of stroke survivors. And thank you for joining our World Stroke Week. We've had a busy week so far with different talks going on, and I'm sure there's more to come throughout the week as well. So today we're having a talk about relationships and sexuality from Pauline Shields. So I'll just do a quick introduction and then I'll hand you over to Pauline. So Pauline is a clinical nurse specialist from the National Rehabilitation Hospital, and today she will be talking to us about the meaning of sexuality and the impact of stroke on sexuality, covering the direct and indirect effects. She will also talk a little bit about treatment options and helpful tips. So thank you, Pauline, for joining us. I'll hand over to you and I'll share your slides as well.
Great, thanks. Yeah, so thanks very much for inviting me to do this talk. It's always great to have an opportunity to speak to so many people about some of the issues that people can have, in this case directed around sexuality and stroke. So as Niamh said, I'm a clinical nurse specialist working in the National Rehabilitation Hospital in Dún Laoghaire. And my main aim for the service that I provide, which is the sexual wellbeing service, is to try and meet as many people as I can before discharge, but to let people know as well that the service is there, because I understand that while you're going through rehabilitation or the trauma of what has happened to you, it can be very difficult to think about anything to do with relationships, sexuality and sex. So lots of times people are, when they hear the word sexual well-being, they're often afraid to actually engage in conversation. So hopefully we'll just dispel some of those myths today with this short talk that I'm going to give. So if you just move on there to the next slide, please. So it's to think about what is sexuality. And I use this sexuality flower to try and describe what sexuality is, because it's so much more than just about sex. It's about who we are as people, our identity, our self-esteem, our body image, but it also includes all of these different petals from the flower. So it can include things like our orientation, our spirituality, our relationships, our emotions, our sensuality, different types of sexual practices that we might like, and our different types of sexual attraction and that. We're all born with a sexuality, and we have a sexuality till the day that we die. I suppose it's how life events can impact on our sexuality that affects how we feel as people. How we feel about ourselves very much depends on how we interact with other people, and it can also affect our relationships then when we've had to deal with trauma in our lives. And trauma can be anything from something that's happened as we're growing up. It can be grief, it can be death, it can be marriage is trauma, traumatic, moving house. There's lots of different types of trauma, but certainly having a stroke can be a trauma as well. And it's about how do we deal with it, and how do we pick ourselves up and carry on after such an event has happened to us. So to try and think that sexuality is much more than just about sex. When I'm talking to patients, I start with gathering a history, gathering a bit of information about how you are as a person, what you like about yourself, what you don't like, how the stroke might have impacted on you, but also how it's impacted on other people close to you, because it has that ripple effect that it goes out and affects the people that are closest to us as well. And then it's only when we've talked about how you've coped with things or how you're getting on or how the stroke has impacted on you or your relationship, if you are in a relationship. If you're not in a relationship, how you'd feel about getting involved in relationships in the future, despite the fact that you've had a stroke. And then I'll talk about the more direct and indirect effects of the stroke and how to deal with some of the direct issues that people can have with sexual function and fertility. So if you move on there to the next slide there, please. We know that brain injury or any type of trauma, as I say, can affect your experience and your expression then of sexuality. And I understand that it's very difficult to come and ask the questions to somebody. My aim is to try and train the staff in the hospital that they are actually offering the service to people, so that you don't have to ask any difficult questions. I'll do all of that bit. But if you don't know about the service, then you can't use the service. And the service extends to beyond your stay in the rehabilitation hospital. So, if you're at home 6 or 8 months post your rehabilitation, then you can still come back and contact me. Just as a caveat to that, for people who haven't come to the NRH, I can still see you, but it has to be with a referral from a GP, because our consultants are obviously they have their own cohort of patients and that, and they're not going to take on extra patients because they don't have the capacity for that. But once I have a referral letter from a GP, then I can actually see people that haven't actually attended the NRH. So if you just move on there, then again, thinking about sexuality is so much more. As I say, it's more than just about sex. Sex is only 5% of what a relationship is. Our sexuality includes things like our sensuality and our sexuality. And, so it's thinking of it all as a bigger picture. So if you just move on there again, please. Some of the research that has come out has one quote that I got in some of the research was that, having had a stroke, it was as if somebody came in the middle of the night and stole a part of me that I never got back. And, lots of people would say similar things, because stroke is out of the blue, it's sudden, and it has such life-changing effects for a lot of people. A lot of the research will also say that things like depression, things like reduced sexual drive, reduced libido, and for some men it can be problems around erectile function. It can be, if their sensation has been affected, it can affect arousal. And for women, then they can also have the similar issues in reduced drive, reduced libido. Sensation can be affected. And I'm going to go and talk through some of those things as we go on through the talk. So if you go on just to the next slide, we know that brain injury can impact so many different things in our lives. It can have an impact on our family. It can be physical, whether you've got a right-sided or a left-sided weakness, whether you've got sensory issues, whether you've got difficulties remembering things. Fatigue, we know, is a huge issue for people with that have had strokes or brain injury. Speech can be a problem, and again, some of the research is showing us that speech and communication can be so difficult in a relationship. Then just even being able to tell somebody that you love them, or to have them understand what it is that you're trying to say. So our social aspect as well, because maybe you're not getting out and meeting people the same way that you might have done before your stroke. So sometimes stroke can be very isolating and make us very lonely. So, and emotions can be affected. And then, as I say, our understanding and behavior in that as well. When you take all of that further out, so if you go into the next slide again, this is the bigger impact as well that it has. So like I say, things like our speech, our understanding, our language, our fatigue, stamina, our movement, our coordination, relationships, personality, tolerance. There's so much that the stroke can actually affect. And like I say, the first part of my job is trying to help you cope with that. And that doesn't include just me. It obviously, we would be talking to maybe psychology, your occupational therapy, your physiotherapy, your speech and language therapy, everything is so important in the rehabilitation process and that as well. It also depends on what part of the brain that actually is affected as to whether or not you have some or all of these problems, but also the same can be said for whether or not you have some sexual problems as well. It can very much depend if the limbic system, which is part of your brain, has been affected. That can affect your emotions and how how you interact then with people in that, because your emotions can be very labile. They can be going up and down, and does impact on self-esteem and confidence, and then how you interact with other people. If you go on then to the next slide, please. Again, this is research that was done from one of our psychologists. I can't believe it's actually more than 10 years ago now at this stage. She did a big research into the effects of brain injury and stroke. So these are the results of that research that is coming back from the people who have experienced the stroke or the brain injury, but also their partners in that. So it can affect because a loss of equality in the relationship. So things have to change in the relationship. Maybe because you might need help now with something, but it's very much about being able to take back your role as much as possible when you're well enough to be able to take back that role. If you are in a relationship, it's making sure that that relationship stays as a relationship and doesn't become a carer patient relationship, because it's very easy for partners to sometimes slip into that carer role. And if they don't consciously think about taking themselves back out of the carer part and being the partner, that can have an effect on the relationship in the longer term. Loss of companionship, like I said, the change of roles in the relationship. Sometimes the partner sometimes has to become the sole decision maker if there's difficulty with cognition or understanding there. The shared meaning between the spouse and the partner. My husband had a spinal cord injury, and I always hated being called the carer. I insisted that I'm always a partner before I'm a carer. And that was something that I was very strong on for all of the time that anyone has ever interacted with me and said, "Oh, so you're the carer?" And I said, "No, I'm not the carer. I'm his wife, but I do some care." So it's really important that people separate those two roles out. If language is a problem or speech is a problem, sometimes people, like I said earlier there, they feel that loss of emotional connectedness because maybe with the speech difficulty, it's difficult to express how you feel to your partner, how you feel about them, how you're feeling about yourself. But like I say, even being able to tell somebody that you love them can be difficult. If you move on there to the next slide. So again, communication, being able to talk about your emotions and how you feel about things. Difficulties with conflict resolution. Sometimes when people find it difficult to talk about sensitive topics, and that would include talking about sex and relationships, it's easier actually to instigate an argument than it is to actually talk about those sensitive topics. So some people will tend to actually try and have an argument rather than avoid those very important conversations with people. Other things then are things like knowing for partners to understand how you're feeling having had the stroke. And like I say, the other changes in the relationship that can happen. And sexual functioning was one of the outcomes that came out of that research. So if you just move on there again, please. So how does stroke directly affect your ability to engage in sexual activity? So things like weakness or paralysis of one side of the body, or restricted movement of your hand or your arm or your leg. So when I'm talking to people, I talk to you as either an individual or a couple, if you want, as a couple, and how you can overcome whatever your restrictions are related to you. So there are ways of getting around some of the difficulties and the problems that we can talk about on a one-to-one basis. Things like loss of sensation. If you've got loss of sensation, even to touch somebody, it can be difficult for you to get the feedback in your own body as to those different sensations. Some people have loss of sensation or reduced sensation around the genital area, and that can affect arousal, because an awful lot of the time we associate sexual arousal with genital stimulation. There is a program that I use, it's called Sensate Focus, that I get people to, it's like mapping the body to find other parts of the body that will become erogenous zones for you, which sounds a bit crazy, but it's actually possible for people to actually learn that and find those other areas of the body that will become erogenous for you. Things like dealing with chronic pain, if you've got, maybe a sublux shoulder or just even nerve pain. Constant pain just drags people down, and it affects our mood, it affects how we interact with people. In a sexual situation, if you can engage in sexual activity and reach orgasm, the body releases its own endorphins, which are natural painkillers. So it's about trying to break that pain cycle. And that again would be an individual talk about when is your pain worse? Is it worse in the morning or is it worse at nighttime? What can you do to help reduce pain? Is it doing exercises, stretching out muscles? Is it using heat? Is it using medication? So it's about timing your sexual activity around the time when that pain is at its least. And again, from the fatigue point of view, that would be similar, in that it's about managing your day, managing your fatigue. If you know you want to have a night out with your partner or that, and you're thinking that you might like to engage in activity, it's about making sure you're well rested maybe the day beforehand, or that you're not doing too much during the day, so that your fatigue is managed somewhat. And I know fatigue is a big issue with brain injury, and it is talked about an awful lot. So I'm not sure if you've talks on that yourselves in this program, but hopefully during some phase, people have talked to you about fatigue. Continence issues are huge issues for an awful lot of patients who do have continence issues. So if people are fearful of engaging in if people are fearful that they're going to have an accident during sexual activity, well, then they're going to avoid. Hello?
Yeah, we can hear you.
Oh, okay. Sorry, it's just gone off my screen, so it has. So
Oh, okay.
that's okay.
We
I'll
can
log.
still see you
Okay,
and
I
hear
can see
you.
you again there now. I just have to remember
Oh,
to move my own mouse to keep it there. So sorry, continence issues can be a big reason why people will avoid engaging in sexual activity. But again, that'll be something that I would talk to people about, is to how to manage any continence issues that you might have, so that you don't avoid activity if that's what you want. Cognition is something, again, that would be spoken about on an individual basis, and memory can sometimes be thrown in there as a problem as well. Not necessarily for the person who's had the stroke, but sometimes for the partners and how they interact with you. Fertility is not necessarily, or problems with fertility are not necessarily associated with having had a stroke for an awful lot of people. But again, it depends on some parts of the brain. If they have been, whatever that has been affected, it can affect hormones, and hormones then can sometimes affect fertility for some people. But even thinking about the comorbidities that people have, so say somebody has diabetes, or people with uncontrolled diabetes, those high blood sugars and that for men can affect semen quality and that. So it's very important that those sort of things are managed. And then medications, the medications that you're sometimes put on for managing blood pressure or dealing with depression, which I absolutely feel that depression needs to be treated if it's a problem, but sometimes some of those medications can actually affect function. So one of the things that I do is I go through all of the medications that you're on and see if they might be causing an issue, and if they are causing an issue, can we change you to a different medication that will do the same job but is less sexually toxic to you. So there are some of the things that I would actually be talking to people about. So again, if you can move on there. So this is just as I say, the way medications can sometimes affect people. They can affect things like your drive and your arousal. They can sometimes affect the orgasm or ejaculation. Some of the SSRIs that people might be put on for depression can sometimes affect that. It's not very common, but when people read the little booklet that comes with the medications and they start reading the side effects, then they sometimes will say, oh no, I don't want to use that medication because I don't want to have these problems. But the incidence of these problems on medications are very low. But we can look at them and see what we might need to change if possible. So if we just go on to the next slide there. So again, it's just giving you a list of all the different types of medications. But if you look at any leaflet out of any medication packet, usually sexual function is put in there because at some stage during research, it was actually identified as a problem, but the amount of times that it happens is very low. But the last slide there, things like alcohol or recreational drugs, people who use alcohol an awful lot or use recreational drugs an awful lot, it can actually affect sexual function and sexual satisfaction as well. So they're in moderation, they might be okay, but people just need to be mindful that they can have a long-term effect on that as well. So if you just go on there as well, then a lot of the research, and I know that's an old slide or an old quote there, but I've actually just been reading stuff more recently, but nothing has changed. The most common sexual side effects that have been identified for people after having a stroke is a decline in sexual drive, libido, and that affects how often then they have sex. For women, that can be a reduced amount of vaginal lubrication, an orgasm for women, and for men there can be problems around difficulty getting an erection or ejaculation. So even though that quote is from 1999, the research that I've been looking at for 2022, it's still the same, it hasn't changed. Okay, so if you want to move on there, please. So what are the aids and appliances that we can actually use? So for women, if there is reduced vaginal lubrication there, and that can happen for women in general going through the menopause, because there's a reduced amount of estrogen, there's a reduced amount of vaginal lubrication. But you can go into your local chemist, you can go into, these days you can go into Tesco and you'll find lubricants there beside where they have things like the condoms and that. They're very easily accessible. You just need to make sure that it's water-soluble lubricant, because they're just safer to use and don't harbor infection. If you keep going through that they'll all click in. So things like if for people who have got reduced sensation, using something like a vibrator can help to enhance the sexual feelings that you would have. Now, that's obviously if people are comfortable with using the vibrator and your partners are comfortable with using it as well. So it's something to consider for some people. Dilators is not really something that for people with stroke, but Eros therapy is, and nowadays you can get what's called a womanizer. So it's basically a small device that has a small little opening that you put over the clitoris. The clitoris is the only organ between men and women that its only function is for sexual arousal. It's made of the same tissue that's in the head of the penis. So it's very vascular and there's lots of nerve endings in it. And the clitoris becomes erect the same way the penis becomes erect. So this device, when you put it over the clitoris and turn it on, it creates a vacuum which draws blood into the clitoris, helping it to become erect, and therefore it helps with sexual arousal and orgasm. So they're devices that can be used. It's about how comfortable are you using a device and how comfortable are partners using devices as well. But sometimes we need to use these things to work around the reduced sensation that people might be experiencing. For men, then we've got the oral medication. So the medications like the Viagra. So nowadays you can get the generic versions. So the generic version of Viagra is called sildenafil. What these medications do is they only help to improve and maintain an erection. They do not give you an erection. So you have to be able to get some sort of an erection in order for these medications to work. And sometimes the difficulty is that GPs will hand over a prescription without explaining how you use the medication. So for instance, the sildenafil, it stays in your blood system for up to 5 hours. So that means once it's in your bloodstream, so when you've taken a tablet, if you take it on an empty stomach, it takes about 30 minutes to get into your bloodstream. Once it's in your bloodstream, it's going to stay in your bloodstream for up to 5 hours. So somewhere within that 5-hour period, for the tablet to work, you need to engage in some form of sexual arousal. So either through masturbation or with somebody that you want to engage in activity with. The normal starting dose of the sildenafil is 50 milligrams. If you find that that works well enough for you, you can have 100 milligrams prescribed by your GP if you have a medical card, because on a medical card you will only get 4 tablets a month. So 50 milligrams works for you. If you get a prescription for 100 milligrams, you can break them in half, it gives you 8 tablets a month. If the 50 milligrams doesn't work effectively enough and you need the 100 milligrams, will then unfortunately only get 400 milligram tablets a month. This is on the medical card. But they're not hugely expensive now. They're much cheaper because it's generic version and that. So it's just about using them correctly. The only time you can't use these medications is if you're on a specific nitrate or a specific medication called a nitrate, which is it's a cardiac type of drug. So it's not used that often, but it would be totally contraindicated if you were on a nitrate. If you get side effects, the common type of side effects are things like a headache, a blocked nose, a little bit more can be things like dizziness. These tablets can tend to lower your blood pressures slightly. So if you found you were dizzy, it's just important to make sure that you're safe for that period of time. Once the 5 hours is up, it's gone out of your system. Any side effects, if you get side effects, will be gone. The oral medications, then, they don't work for everybody. They work for a very high percentage of people, but they don't work for everybody. If they don't work, then an alternative is injection therapy, which is an injection of a drug called a Prostadil into that you inject into the spongy tissue of the penis. It needs to be taught how to set up the drug. It needs to be taught how to administer it safely. if you've got weakness in one hand, or that sometimes partners might need to be taught how to use it, and that it's effective. It's not used that commonly, but it is available. And then the next treatment available would be something like the vacuum pump. So similar to what I spoke to about the womanizer for the women, it's a device that you put over the penis. When you turn it on, it creates a vacuum which draws blood into the penis and gives you an erection. And then there's a small ring that you would slip off onto the base of the penis to hold the blood there. The only rule with the vacuum pump is basically that it must be removed every 30 minutes just to let things go back to normal, and then you can reapply it and use it again. And again, sometimes people would say, they don't want to be using a device. Some people like the vacuum pump because it's no medication going into your body. Some people feel it's a bit mechanical, but it's how you use it in a sexual situation. So maybe having a partner use it on you, or using it before you engage with your partner. But one of the things there as well is hand function might be a bit of an issue. So partners sometimes have to use it for you. So there's just one more on that, but that isn't relevant as such to people with stroke. So if you go on to the next slide, please. So as I said earlier, things like self-esteem and body image are two of the biggest issues that I will talk to people about, because if you don't feel good about yourself, then it makes it difficult for you to interact with either your own partner or meeting people in the future. One of the biggest fears that partners have is that if they engage in sexual activity with you, that you might have another stroke. And it's a very common and very understandable fear that people have. The likelihood of it happening is extremely low. I could never say never, because no one can ever say never. But the fact now that you've had the stroke, they know why it's happened. Most likely your blood pressure has been managed much better, or if it was from blood vessel leaking or whatever, because you're now being medically managed now, it's very unlikely that it would happen that you would have a stroke during sexual activity. And I mentioned earlier about the fear of incontinence, making people avoid situations because they have that fear that they might be incontinent during sexual activity. We need to talk to our partners and find out what are their concerns or what are their issues, and what are they maybe struggling with as a result of all the change that has happened in life. Things like anger. If we're angry, a lot of the time, the people that we take our anger out on are the people that are closest to us. So if we don't manage it and don't deal with it, then most likely the person who's getting the brunt of the anger is your partner. And long-term wise, that's going to have an impact on your relationship as well. Anxiety about being able to perform sexually can make people avoid. And I've talked to people for many years doing this job, and a lot of people will say, or I've come across, that they won't even give partners a kiss or a hug because of that fear of not being able to perform. If they fear that they're not able to perform, they feel if they give their partner a hug or a kiss, the partner is going to expect that it's going to go further, and because they can't perform or don't have the information to solve the difficulties that they might have, well, then they just avoid. And again, avoiding even just hugs and kisses can have an impact on the relationship in that as well. Depression, as I've talked about earlier, I do believe it's very important that depression is managed. It's not something that will be there forever. You might need to use some medication just to get you through a difficult time. And then once that mood has stabilized or settled, or you've through the trauma of what's happened to you, you can start to reduce the medication that you might need for treating the depression. And like I say, lack of knowledge. If people don't know what they can do or what they can't do or need to avoid or to keep them safe, well, then they don't engage, and that makes things very difficult as well in a relationship situation. So if you move on, please. So talking to your partner is very important. It's very important to talk about how you feel about what's happened, hear what they have to say about what has happened, have a good cry together about what's happened, and then try and move on about things. So it's very important that you create a safe time and place to have these conversations, and not to have a conversation about everything at the one time. Just talk about one or two of those issues, and then try and come to an agreement, and then maybe another time talk about something else. Focus on the positives, which can be difficult when you're going through so much difficulty and so many issues at the time. Reminding yourselves to avoid having those arguments. Discuss the fears that you might have around sexual rejection, or how you might feel about fears about the relationship breaking up. They're tough conversations to have, but they're very important to have. A lot of the time, couples avoid talking about the hot topics because you don't know where it's going to go and you don't know what's going to happen. But it's very important to actually be able to have these conversations, know where each of you stand, and then try and move on together as a result of that. So if you move on, please. Oh yeah, and it's so important just to be able to hear what it is that your partner has said to you, and for them to hear you. And if communication is difficult, it is very important, and simple exercise can be just talk about a topic for a couple of minutes, have your partner feedback to you what they have heard, and then you clarify that what you've actually said is what they have heard or what they've understood. So it's important to be able to hear what people have to say, but also to understand them, because we can interpret things differently to the way that they were intended. So it's very important that you're clear on what it is that you're talking about. So if you go on now to the next slide, please. Remember that if you are in a relationship, that partners have been affected by what has happened to you as well. And like I say, that discussion is very important. Be prepared to listen, then talk, and then discuss the negative issues that might be there. Again, I know I seem to harp on a bit about it, but treating depression is so important if it's something that has been going on for a long time and is creating difficulties. Spending time just getting used to the body changes that you have experienced is really important as well. So to know where you have sensation, where you don't have sensation, where you've got limited movement, getting used to the body changes that have happened, and looking after yourself and being kind to yourself. When you've been through a trauma, it's so important to actually be kind to yourself and not put yourself down about things. Go and do the things that you enjoy doing, whether it's going out and meeting a friend, whether it's reading a book, whether it's a bar of chocolate or a glass of wine, whatever it is, just be kind to yourself as well, and be kind to your partners as well. Maintaining all those other good health practices are really important as well. Things like your diet, your physio, pain management, and alternative therapies as well. So if you move on there, the complementary therapies that, it's a slide further on actually, yeah. So like I say, you might need to learn to improve communication, listening to what people have to say, ask for what it is that you need. Sometimes we're afraid to ask actually for what it is that we need or what it is that we want, but that's very important. And what is it in life that gives you pleasure? There are, it's not just about sex, it's about experiencing pleasure and joy, being able to spend your good quality time together, which is really important, as well as having your time apart, because your time apart for both you and your partner, if you are in a relationship, is very important, just to be able to get that headspace time, clear your head so that you can come back and look at things in a different light if needs be. Let your partner off the hook sometimes. That's really important as well. you know, it's not always other people's fault either that this has happened to you. It's nobody's fault. It's just something that has happened that nobody has any control over. So don't be hard on yourself about it, but don't be hard on your partners about it either. And if you need to go and get help, it's really important. Talk to psychology, talk to your social worker, talk to your GP. Come and find somebody like myself if you feel you need to talk to them or that. And like I say, it's so important to be kind to yourself as well and others. And if you move on there, please. So those complementary therapies can be really important as well, because it's just a way of helping you to heal as well. So things like meditation and getting your headspace is so important. You can get very good apps these days that actually will help you through meditation. It helps you through stress. They talk about body image. There's Headspace. There's another one called Calm. They're very good if you feel that you can give your 5 or 10 minutes a day to doing something like that. It's just so good for your own head to be able to do these things. Learning how to relax. That's a tough one for an awful lot of people, because a lot of the time we're doers, and we don't think that relaxation is actually important, but it's important for everybody, so it is. Things like reflexology, massage, and acupuncture, they're all helpful therapies that we can have and that we can use. The next slide there, please. And the other thing around sexual activity is it's not all about penetration. There are so many ways to express love, to experience sexuality and sexual closeness with people without it necessarily always. If we think that it's only about penetration, then we're missing out on an awful lot of fun, joy, laughter, and good times. So sometimes it's about talking about other things that you can do that still maintain sexual intimacy without it all being about penetration. So just if you move on to the last slide there, then it's been said that the only material thing that we truly possess is our body. We're born with it and we only relinquish it when we die. It's the foundation for our physical existence and provides the housing for all our emotional, mental, and spiritual experiences. So we have to learn to respect it, to listen to the messages that our body is giving us, especially the pleasure, maybe not the pain and maybe not the fatigue, but responding to them, dealing with them, and learn to care for our bodies. So viewing ourselves with compassion and a loving eye can truly improve the quality of our lives. And that's the end of the presentation. So if anyone has any questions or that, I'm happy to try and answer them for you.
Thank you so much, Pauline. We will just turn the recording off for the questions if there is any, and if people feel free to put anything in the chat as well. But just a question I had just about your service that I thought would be good just on the recording for anybody maybe watching back. You mentioned there that you the service that you do and speaking with different people is extended after somebody stay in the NRH, but if they weren't involved or hadn't been through the NRH, how would they be able to kind of come in and speak to you through a referral maybe? Or
so yeah, it has to be through a referral from either a GP or a consultant.
Okay, brilliant. That's
Yeah.
great to know.
Yeah.
Okay, thank you. I'll just stop the recording here.
Okay.